right now we're going to share some health news with you here on Voices, and the CDC is reporting this last flu season has been the deadliest among children in the past 15 years. 12 pediatric flu deaths reported for the week ending April 26th, bringing the total number now up to 216. The last time that many children died from the flu was during the swine flu pandemic back in 2009-2010, when we had 288 flu deaths. The previous high since then was 207 during the 22-23 flu season. Obviously, this stuff fluctuates. Let's ask our pediatrician about it. Dr. Steve Turkovich is back with us. He's president at Oishei Children's Hospital. Why do you think this flu season has been as bad as it's been?
You know, that's a great question. You know, the flu does go through stages, and sometimes it has to do with the vaccine, and maybe the vaccine's not as good, or we have low vaccine rates, which we did see this year. But sometimes it's just the strain, and kids seem to be a little bit more vulnerable than adults. They're sort of in the bucket of older adults, so many times we think the flu is just the flu, but you know, it can be deadly. The good news is over the last 2 weeks at Oishei, we have not had a single child admitted with the flu, so I think it's safe to say this season is over, but you know, the next season around the corner, make sure when the fall comes around, get your child vaccinated.
Yeah, important stuff there. I also want to ask you about these recent comments that a lot of people have been discussing from HHS Secretary Robert F. Kennedy Jr. Discussing autism. Basically, he said it's preventable and that it destroys families. A ton of backlash to those comments, including from some physicians. And so what I wanted to ask you, there's a lot we don't know about autism, right? There's a lot of research that's continuing now. But what do we know about autism, and how important is it to sort of get that message out?
So autism is a condition that's a spectrum. So every child or every person with autism is an individual. They're going to express their interactions with the world in different ways. Some children have the ability to be verbal, some of them are not. Some of them have challenges interacting socially. Some of them really need significant routine in order to really feel comfortable. But at the end of the day, we know that the signs of autism can be seen as early as 6 to 9 months. So we're learning a lot about it. One of the reasons why there's been such an increase in the diagnosis is because we know so much, and we've been able to identify it really early. We're also defining it. So it's sort of like when we had an increase in breast cancer cases. We saw that back in the 70s and 80s because we were screening for it with mammograms. So we don't know a lot about it, but it is neurologic, so it's something within the brain. Some of it is genetic, some of it may be related to the environment. The one thing we do know is that it is not related to vaccines. And the fact that we can see signs of autism before they're 12 months of age, before they get the MMR vaccine, which is some have said has been associated, it is not. Thousands and thousands of studies in children have been studied showing no linkage whatsoever between the MMR vaccine or other vaccines and autism.
So important. We appreciate your time. Dr. Steve Turkovich, great to see you.
You too.